Good morning, everybody. This is Dr. Tyler Evans from Arete Chiropractic coming at you live on Tuesday morning, right at 7:20, live and early for the research moment. Today, what I want to talk about is a brand new, I believe it's a chapter in a textbook that Scott Rosa, John Baird, and David Harshfield just produced. Really, really well done. Kind of rehashed a couple of ideas that I've presented on the last few weeks, and the main doc here that we're talking about, Scott Rosa, he produced this book, or well, he didn't produce the book, but he produced some great research that came out of this book, the Craniocervical Syndrome and MRI back in 2000 and I want to say 13 maybe. But recently, and this is kind of a continuation of that information and just a little update. And it just continues onto why the heck is your neck so important and what the heck is Craniocervical Syndrome. So a lot of patients come into our office and have head pain, neck pain, dizziness, a lot of other symptoms that kind of go along with those lines. And they've been to a lot of different practitioners. They've been to a lot of other places. They might have been to the chiropractor. They might have been to the massage therapist. They might have been to the general doctor, maybe even the neurologist. And they just aren't getting answers as to why their symptoms are there. Well, that's what Craniocervical Syndrome is. It is a misalignment or malformation of the top joint up here and how it affects the rest of the body. It can literally affect your brain and your whole body down, and I'll tell you why. So the joints in the craniocervical junction consist of this bone here, which is your occiput, this bone here, which is C1, and then this bone here, which is C2. Now, this joint is very important because through this hole runs a lot of important stuff. It includes your brainstem. Your brainstem sits right in here. The base of your brain sits right here, and the area of this part of your brain is what controls breathing, heart rate, respiration, immune function, digestion, all kinds of things, because that's the reptilian brain. That's where it lives. And so if we have a problem, hey Janelle, good morning. So if we have a problem in that upper neck that might be looking something like this, like a misalignment of the joint, it can compress the nerves up there because there are attachments at the bone into the brainstem, into the spinal cord. And so what we see in this office is that people have accidents and injuries like whiplash, like car accidents. And what happens is that very delicate joint, this joint right up here, can be twisted and locked out of position. And when it is, the soft tissue gets pulled down, it gets stuck out of place. And so no matter where you go, if you go to the, good morning, and if you go to the chiropractor, it may not get what we want to do here, correct that upper neck so that the connection between the brain and the body is restored, so that the body can heal again. And what we see is in these car accidents, in concussion injuries, where we've had a blunt trauma to the head or the neck, there's just not a lot of help that's gotten in the regular healthcare model. And so what we go and do in this office, in upper cervical chiropractic offices, is we specifically analyze and look at how this joint is aligned, how the bones are sitting, and then we take specialized imaging to see exactly within millimeters where bones are rotated, where bones are malpositioned, so that we can specifically correct it, get it back into place to get the fluid flow back, to get that information balancing through that hole back and forth to the rest of the body. That joint is so complex. It's literally the most complex joint in the spine, possibly even the body, because all the messages that come down from your brain that have to get out to your body, they have to go through that upper neck. And so when there's a misalignment there, it can literally cut off the nerve flow from here down. And that's the joint that gives 50%, that joint right there gives 50% of the rotation And the flexion extension in your neck, it comes from that joint. So it's very mobile, but it's also prone to injury. Okay, and so you need a specialist to check that out, and that's why that area is so important, so important. So if you've had a whiplash, if you know of people that have suffered from head and neck trauma, head and neck injuries, even if it's young, you know, we see little kids that have birth trauma to the neck, and they can have a whole host of problems just starting right on from birth and then going on through life, and they might have headaches, they might have neck pain, and you just push it off. Well, their brain is literally getting disconnected slowly, you know, just slow misalignment, slow cutting off of that nerve flow between the brain and the body. So that's what we correct. When we look at that upper cervical spine, we're getting that head back on straight, getting that head sitting back over C1 and C2 to help the nerve flow come back through that hole to balance so that the rest of the body heals and the brain heals as well, because the fluid has to get up and get out. And so when we correct that, that's what we're working on. All right, so if you have any questions, let us know. But if you know of people that have suffered from head and neck injuries, we call it Craniocervical Syndrome. Headaches, dizziness, neck pain, a lot of other chronic head and neck pains and problems can be included in there. And getting that upper neck checked is a real good solution to have someone check and specifically correct and see if that's part of the problem. It's the nervous system is what controls the body, and so somebody needs to be checking it. That's what we do, upper cervical chiropractors. So again, Dr. Tyler Evans, Arete Chiropractic in Portsmouth, New Hampshire. If you have questions, give us a call. Have a great day. Take care.